welcome to our podcast. I'm Brittany and this is Ashley, and we're occupational therapists at Therapy Playground. We've both been asked several times questions like, what should I do if my child needs an evaluation? Or what will you be doing during the eval? Or even, how long is this going to take? So we decided to put together this little podcast to try to answer some of those questions, and also hopefully help families better prepare to make the most of their time spent here. So the first question I want to answer is, how do I begin the process of getting an OT evaluation? So you need to go take your concerns to the doctor and request an OT evaluation. If it's recommended by the physician, then a referral will be made. So Ashley's going to answer our next question. What should I know beforehand to help my child best participate in an OT evaluation?
Well, first you should expect 2 hours of testing. We ask that you arrange for childcare for your other children, that way you are able to participate in the OT eval. Arrive early to fill out paperwork or bring paperwork that can be found on our website with you. It is necessary for the primary caregiver to be present for the whole eval. The therapist will be asking the caregiver questions about what the child can do, and that way we can get a larger picture of the child's level of function. We ask that you know the child's developmental milestones, such as when they walked, crawled, or rolled over. Make sure to clarify which location that you're supposed to be at. Have your child wear loose-fitting or comfortable clothing so that he or she can move easily. And although we highly encourage the parent participation, it is necessary for us to determine the level of skill without any assistance. We need the opportunity to see the areas that may be difficult for your child in order to find out what we can do to best help them. It may be difficult for you to watch your child struggle with tasks, and you may want to try to help them, but it will be best help him by allowing us to determine underlying challenging areas as he completes the task on his own. What should I bring to the OT eval?
So it's important to bring all of the equipment that the child uses to participate, whether it's braces, splints, orthotics, any type of adaptive equipment. Even glasses is very important that the child brings to the evaluation. Also, it's important to bring the prescription for OT, and now that could be faxed over ahead of time, which is definitely okay. Also bring the names and addresses of any of the doctors or people that you would like to send the copies of evaluations to. Bring the child's IEP. Also, any documentation of testing that's taken place, whether that be genetic, psychological, neurological. All case-related history information is very helpful. It's important to bring concerns related to functional performance. And what I mean by that is, my child has difficulty tying his or her shoes, or difficulty holding a pencil, trouble remaining on task in school. They're not able to tolerate loud sounds, or any type of difficulties with activities of daily living, like getting dressed, feeding, self-care. It's important to bring your insurance card, and that will be taken at the front desk. The parent questionnaire should be brought if it is filled out ahead of time. And also bring a sample of your child's handwriting in. It helps for us to have a sample that was written in the child's natural environment so that we can get a look at that to see if there's other factors playing into the difficulties with handwriting. Finally, if feeding's a concern, bring food to the evaluation. Bring a few preferred and non-preferred foods so we can take a look at that too. So Ashley's going to answer our next question. What is the purpose of an OT evaluation?
An OT evaluation is used to determine to what extent functional performance is being affected by underlying factors. In children, OTs look at areas of occupation at home, school, and in the community to see how those areas of difficulty are impacting their ability to best perform and encourage increased independence. The child's main occupations are play, school, and activities of daily living, which include things such as getting dressed, taking a bath, or feeding themselves.
So how will the child be assessed?
Well, we always do a parent interview. The parent interview includes things such as questions regarding their level of function or the areas, including the activities of daily living. We always do a standardized assessment. These include PDMS-2, BOT-2, BRI-BMI, or a visual assessment. These give us descriptions of the child's level of function, such as average, below average, poor, above average, that type of thing. We will also have the parent fill out a sensory questionnaire if there are sensory concerns, and this will help us determine which areas of sensory processing the child may be having difficulty with. And then we also use what's called skilled observations. This is where we use all of our specialized training and observation to find difficulty in areas such as how the child is holding the pen or pencil, their quality of movement, their strength, positioning, following directions, and motor planning. So Brittany, once the assessment is completed, what happens next?
The evaluating therapist will then recommend frequency and duration of services if they are recommended at that time. Typically, that would be 1 to 2 times per week or 1 time per month, but that can vary. The evaluation will then be sent to the referring physician, and the child will be scheduled as convenient for the family within the times open. The therapist will then continually update and work through the OT process until the outcomes are met.
All right, well, I think that covers just about everything. If anyone has any questions, please feel free to leave a comment below. Thank you. Like and subscribe!
I can't start it. It feels so awkward to start it.
Gosh, why do I always do this? I am so sorry. This is what I do.
It's very important that you bring functional